So what is your name?
My name's Christina Williams.
Where do you live?
I live in Maplewood, the St. Louis suburb.
How old are you?
I'm 38.
And what was your first reaction to COVID?
Hmm. Well, my first reaction was uh, kind of like some skepticism and disbelief, like when it was first coming around. But I, I would talk to um, some friends of mine who were kind of watching what was going on when it was in China and when it was kind of headed our way in Italy and everything. And and it seemed like it was kind of a different thing. Uh, so I'm a nurse and I work at a behavioral health unit. And I remember talking to people, coworkers about it this was probably like early March, like before the lockdown and everything. And most people did not think anything was going to come of it. Um, and and just a lot of skepticism, a lot of people kind of saying, oh well, yeah, it's a lot like uh, remember Ebola, remember when that happened, and it really wasn't that big of a deal. But we all know it is a big deal now. So,
So yeah, go into that. How has your reaction changed to now?
um, I mean, this is like one of the biggest things that has ever happened to the world that since I've been alive, you know. Um, I I am just worried. I worry a lot about how it affects a lot of people's mental health. Um, my my daughter is 2 years old. She's a toddler, and we would have put her in like a daycare by now, but she, they're not really doing that in Maplewood, and so I kind of worry about how she's going to be socialized. Um, at work, I work on an inpatient psychiatric unit, uh, and mostly I get floated around a little bit to adults here and there, but I mostly work with kids and teenagers from the ages of 3 to 17. And with the virtual schooling uh, and also just being isolated, I think is the biggest thing. I don't think the virtual school is having the biggest impact on the kids that I'm working with. I think it's the isolation, um, and and we have a lot. I mean, our census has been up. Kids are just anecdotally seems like they are more depressed, more anxious. As part of my assessment, I ask them what the big stressors in their life are, and and COVID is like always one of them. So that's kind of what I'm seeing in my life, I guess.
Um, so could you go into specifically like what you do in your job?
Sure. So I'm a psychiatric nurse. Um, I work at DePaul, and within DePaul there is a facility called St. Vincent's Behavioral Health, and so this is like where people who are like emergency, like crisis, it's crisis stabilization. So if people are suicidal, if they overdosed, or if they want to hurt somebody else, that's like pretty much buys you an admission there if you want to hurt yourself or somebody else, or if you've tried to. Um, and uh, and so that's the type of facility I work in. It's completely locked down. The patients wear paper scrubs that rip because some people want to hurt themselves so badly that they will tie cloth or bed sheets even around their necks to try to hurt themselves. So lots of like interventions like that, like the paper clothes. And what's another thing? Like they can't use scissors. We give them like little golf pencils to write with because anything bigger might maybe be a weapon, or they might hurt themselves or somebody else with it. So that's kind of the environment. So my job as a nurse, working with the kids or with the adults, but with the kids, we program them during the day, which means that they are in kind of group therapies, group and recreational therapies throughout the day to kind of like keep them busy and engaged. And in the groups, they learn some coping skills. Nothing too intense because it's crisis stabilization. So anytime you're doing therapy, it takes a really long time to like build a relationship with your therapist, and it takes like weeks and weeks. We only mean for people to stay there 3 to 5 days. So it's a short-term crisis stabilization. I also work a lot with medications, with administering medications. It's a big part of a nurse's job throughout the hospital, even on medical floors and stuff, and doing assessments. So, talking to the patients, asking them, how, like, what brought you to the hospital? What are you feeling? Are you feeling depressed? What are some symptoms of depression you're feeling? Have you been losing sleep? Have you been sleeping too much? Have you lost your appetite? Have you lost interest in doing different things you normally are interested in? Talking to them about anxiety, asking them if they feel like right now, do you want to hurt yourself or somebody else? Helping them identify stressors and things like that in their life. So that's kind of what I do. I also teach at UMSL. That's where I am right now with a whiteboard behind me. I'm teaching undergrad nurses who are working towards their bachelor's right now, and for their psych class in nursing school. And I'm in school right now working towards my doctorate for and a nurse practitioner for psychiatric mental health.
Okay. So how have all three of those different things that you mentioned, you teaching, being a nurse, and also you going to school, how have all of those changed? And actually, one question: if you're going to school, is that was that going to be virtual either way, or were you planning to go in person?
So the program that I'm in at UMSL was always online, but UMSL and I kind of chose them because of this. They have kind of a cool component. Almost every nurse practitioner program is online. We're kind of hard pressed to find one that's in person. So it's kind of the trend that these nursing graduate programs are going towards anyway. But UMSL has a cool piece. They call them intensives, and so you come onto campus for 3 or 4 days each semester, and you get to, you get to network with your peers, and you get to do like hands-on activities, which is really important for nursing, right? So I'm going to be a psychiatric mental health nurse practitioner, which is like a psychiatrist, right? So I'm not really doing so much like listening to the heart and lungs and stuff like that. But there's a lot of people in my program who will be doing that. But UMSL brought us on to do, for instance, like the intensive this semester was to come up and do head to toe as you would if you like go to the doctor. How to look in your ears, how to look in your eyes with the ophthalmoscope. You can read about these things all day, but unless you're like practicing it and doing it on people, it's kind of hard. They also hired medical actors for us to do a female pelvic exam with. It's like a genital exam. So like, it would be so weird to like just go into the field, in your residency, having never tried to do that before, had any guidance, because it's such a delicate subject, right? So UMSL does that, but in addition to the mostly online learning. But now, and we did get to do it this last semester, but I don't think they're going to do it continuing in the spring. I don't think they're going to do it. It'll be some kind of online version of that, and I don't know when they're going to bring it back. So that's like my educational experience. The students that I'm working with, classes have UMSL was having some classes. They had moved to like a lot of online classes this semester, and this is the first semester I've taught on a college level. But with nursing, so I'm actually a clinical instructor. So their course, like the psych nursing course, that teacher, she was doing her class online. But for clinicals, for nursing, you typically go to the hospital, you bring the students onto the floor so they can work with patients, and they can practice being in a hospital and practice taking vital signs and practice just talking to patients, because it takes practice, right, to feel comfortable. And so nursing programs typically have several classes where you're going to clinicals, doing these hands-on learning with patients. A lot of schools have simulation labs, and UMSL has a simulation lab where they have like dummies, and the dummies even like have a heartbeat, and you can like put your stethoscope up to them and like listen to them. So they've had to compensate with a lot of the simulation labs. I know that that the clinical that I'm working with, we could not actually go to a behavioral health facility, which we normally would have done. I thought we were going to do it when I signed up to do this job. In, what was that, August? They changed it, pivoted at the very last minute, and said that we have to do it in a classroom. We do it with a simulation, which is kind of like, that video game Sims. It's kind of like Sims, but for psychiatric patients. It's really bizarre, but try to make a learning experience out of it. And I know that they were, the group that I have, they were going to a clinical at a hospital. I think it was a BJC hospital, but their clinical had to end a few weeks ago, and they've just been doing Zooms and simulations because the floor they were on turned into a COVID floor, converted to a COVID floor. And I guess the university, like due to ethical concerns, maybe they don't want to allow students to work on the COVID floor. So I know that my students have been like very stressed out about that. They feel like they are really missing out on their education, like they're not going to be prepared. But I think that a lot of like on the bright side, the silver lining, if there is one, to COVID is like this increased use of technology. Everybody knows how to do Zoom now. You know, UMSL has, they actually are just moving forward with plans to revamp their simulation lab. I know that in talking to the other clinical instructor that I work with, she is a practicing psych nurse practitioner, and a lot of her appointments have had to move to virtual appointments over Zoom or Google Meet. And she's actually had better compliance, better attendance. People will make their appointments more often if they can do it virtually, especially if you're depressed and you can't leave the house, right? Or if you have transportation issues. You know, these are a lot of people who the type of population that you're working with in mental health. I know that it's also a hot topic that there is a shortage of mental health care providers, doctors, and physicians in general, particularly in rural areas. So for mental health, I think that with the event of COVID, I've been reading a lot of research and writing in my graduate classes, writing a lot and researching a lot about how there has been like this, we've been pushed into, forced to do this telehealth, which is basically meeting with your healthcare provider over Zoom. And it was kind of a thing people were playing with before, but it met a lot of resistance. And now, because everyone has a lot of people have had to implement it, it has some upsides.
So what have you been doing during quarantine?
Well, honestly, like my life hasn't changed a whole lot because I've been very busy. Like I said, between teaching and going to grad school and having a toddler and working, I mean, I'm pretty busy anyway. Just and try to spend time with my family and try to work on school stuff most of the time. So like my day to day, and I still go to work, right? Because nurses can't work from home. So my day to day really hasn't changed that much, but like everybody else, or I guess not everybody, but like a lot of people, my social life is totally in the toilet, right? I haven't seen my friends like I usually do, and I haven't seen my family like I normally would either. So that's been stressful.
So have there been any worries about either your job or having to teach?
Worries about my job. I'm not worried I'm gonna lose it. Like I think some people, you know, were getting furloughed and laid off. So that was like kind of like the initial thing. I was like, wow, I'm like really glad I'm a nurse because like always have a job. But as this thing has worn on, there are anxieties associated with going to work, you know. With I kind of go back and forth of like if I'm a high risk person to hang around or a lower risk person to hang around, because um, all the patients are tested before they reach the unit. They're COVID swabbed, but the test is pending. So we don't actually know if they have it or not. There's also some um, there's some issues with when you get tested versus when you're exposed. So if they were exposed the day before they went to the hospital and got swabbed, the test will be negative because you really should be tested within this 5 to 7 day window from when you were exposed. Otherwise, you're going to get a false negative. But a lot of people that I'm with when I go to work are monitored. Like at least they've had a test. At least my coworkers I work with, you know, they take our temperature every day when we go in there. And in theory, we're healthcare workers, so we're maybe like more in touch with if we're feeling sick or whatever. But you know, it's stressful when somebody pops up, when one of your patients pops up positive, and the environment of a psychiatric unit is different than a hospital. You've probably been to like a hospital at some point in your life, right? To like visit somebody or something. Typically, patients are in their rooms. The nurses are at their nurses station, or they're working, you know, going to the patient's rooms. It's not like that in psych. They have what's called the psychiatric milieu, which is everyone is like out mingling with each other. It's you're doing groups with each other. You're watching TV together. You all eat in the dining room together. Uh, you have your own room with a roommate, but in a shared bathroom. But you know, they're out in the milieu. They use the same. There's 2 or 3 telephones that patients can call out on. Um, do they get to be wiped off in between each use? No, they don't. It's just not practical. We also have had a shortage on, you've probably heard about the shortage of PPE, the personal protective equipment. They weren't giving us masks at first, then they did. Now we're starting to have, we have like surgical masks, but now that we're starting to have some patients who are COVID positive on the units, like if I go to request an N95 mask from the supervisor, I get trouble about it, you know, because I guess there's a shortage, but like I ask for it if they have it. They also were like seemingly rationing what's called cavi wipes, which are disinfectant wipes. They're all located in the supervisor's office. So, you know, if you want to clean something, if you want to be really good at cleaning things and wipe everything down, then you're going to have to be making several trips to the supervisor's office to get more supplies, and it's just not practical. So there's like a lot of stresses with being in the type of environment that I work with, or that I work in. Just it's so communal. And they talked about how nursing homes and college dorms are really vulnerable to outbreaks because everyone's living in the community. That's, I mean, these behavioral health units are very similar to that.
Um, have you ever gotten well, I'm guessing you have. So when have you gotten tested for COVID and how was it?
I've actually I've actually never been tested for COVID.
Oh,
They don't we don't get tested unless we have symptoms. I've never had symptoms.
okay.
Even though yeah, I've given COVID tests to people and it looks like it hurts a lot. And it's real tricky to give, but if you have
Wait,
someone who's not cooperative, yeah. Hmm.
that's interesting. I've never had someone who's actually given it the test.
Yeah.
Uh,
Uh-huh. Yeah.
um,
Yeah. So we in the hospital they do the nasopharyngeal swabs. So um it's the same test that you do for a influenza. Um, when I used to work at SLU Hospital, and we had to give the flu swabs. We were able to call the specialty nurse who would come in and give the swab so the patient wouldn't be mad at us for the rest of the day because it's so uncomfortable. Um, so we don't have the luxury to do that anymore now. But the COVID swab, it's a long. Have you had one before? A
I
COVID
have
test?
not personally had it. My mom has though.
Okay. There's some different kinds. There's like the swab, or they swab the inside of your cheek, or you can do like the inside of your nose, but supposedly the gold standard is the nasal pharyngeal swab. So it's a long skinny uh toothpick, a long skinny um Q-tip is what it looks like. And and you insert it into the nose, and you know, I don't know if you've ever like had postnasal drip or like sniffed real hard and then you feel it like going down the back of your throat. Feel the snot going down the back of your throat. This is all connected. So you go in through the nose, and and the goal is to hit not the back of your throat, but like just above that. That's the nasopharyngeal area. You got to twist it a couple times and then come out, and then you put it in a solution, send it off to the lab.
Okay.
Those are the PCR tests. Mm-hmm.
Do you have any plans for the future, like either for Christmas or something else?
Um, so my mother-in-law, my husband's mom, is older, and she's like in her late 70s, and we didn't see her for Thanksgiving because it was too, I don't know, just like didn't feel comfortable um, going to see her with how many people I'm working with at work, and then I mean, it seemed to get COVID seemed to get really bad recently, just and right, it's gotten even worse, but it was starting to get bad before Thanksgiving. So we didn't go see her. I recently moved to changed my status at work so that I have like a very flexible schedule, um, where I can work as much as I want or very little, very few hours. And so I won't be teaching over Christmas break, obviously, and I want to try to time it so that I don't work about 10 or 12 days before I see my mother-in-law, and we'll be able to see her for Christmas, and she'll be able to see her granddaughter too. So that's kind of one of my plans, is to try to like take a little bit of time off work before the holidays so I can feel comfortable about visiting with my family. I don't know if we're gonna share a meal. We still kind of have to see how that goes. We talked a lot about how, if we are able to sit outside and wear masks and visit and like kind of sit far apart, that's probably pretty okay if we're all feeling healthy. But every time you remove one of those your risk can go up to like sharing a meal and taking your mask off and all that stuff. So I think we're gonna try to go see my mother-in-law. I'm not sure about the rest of that. We kind of talked about my husband and I and my daughter, who's 2, about maybe taking a trip to like a cabin somewhere. But I don't know. We're kind of kicking that around. If we did go out of town, it would be driving, and it would be something like pretty isolated like that, like a cabin or something like that. We talked about camping too, but I think it's going to be too cold right now. So that's about it.
So what do you think about the government's response? And also, what do you think about like how the hospitals have responded, specifically the one you work at?
Well, as far as the government response goes, um, I think it would have been hard for any president, for any administration, to deal with something like this. I think that when Trump did um, those press briefings, the idea of that was cool, to do those daily and to have that open line of communication with the public. But I think that putting all of the money into the vaccine, putting all of the eggs into that basket, may have been a misstep. We are about to have a vaccine. It should be available. I have a friend who works at Mercy who's already gotten paperwork about starting to give the vaccine out. But the last poll that I looked at, I'm sure there's been a more recent one, but it was taken by St. Louis Public Radio in October, and it said that 51% of Missourians said they would get the vaccine. So the vaccine doesn't do us any good if people don't get it. And it's not going to do us any good if the right people don't get it, the people who are vulnerable, who have those high comorbidities or whatnot. So I wish that the government would have put more money into developing better testing, into rolling that out quicker, to getting more PPE. We have had enough people. I mean, We have had, it doesn't seem like we have run out of PPE, but I can't, at the hospital that I'm at, but I can't tell if that's because they're like rationing it because they're scared they're going to. Um, I also think another thing with the CDC, and I've talked to some other people about this, you know, in the beginning, they said that you didn't need to wear a mask. And I don't know if that came from their boss, Donald Trump, right? I don't know if that came from their boss because they were afraid that they were going to run out of PPE and that people were going to like buy up all the masks and hoard them like they did with the toilet paper. So maybe that's why the CDC said that, but that was a grave error. And ever since that, I think that with public health, there have been a lot of great examples of of public health education in this pandemic, right? We all know about like the 6 feet. A lot of people know about the masks and everything. Um, and wash your hands, right? And we all know like how long you should quarantine and all that stuff. So there have been a lot of successes with public health education. But from the but when you start off saying you don't need masks, and then yes, we do need masks, that starts to erode the public trust in saying, well, I mean, CDC, do they really know what they're talking about? Um, and and I think, and what I do definitely also fault Trump for is his his attitude or his acceptance towards the attitude of um, not wearing masks. Um, and of course, calling it the China virus. Um, I think that had we have had someone as our, if we would have had a leader who would have been taken this more seriously, or at least have had like a serious attitude towards it, encouraged people to you know, to take precautions and stuff, had that kind of attitude toward it instead of having rallies and stuff. I think that would have been helpful, would have made a big difference. I think Parsons also has not been effective and not implementing that mask mandate. Another poor example of leadership I saw was the government. I saw a tweet from the governor of St. Charles a couple weeks ago said that he wasn't going to implement the mask mandate because you can't put a police officer in every state. Like, don't you know how society works? Like, you make laws, you make rules, and then most people will follow them. You don't have to like, you know, put a police officer everywhere to make sure everyone's wearing a mask. You know. So yeah, I think that the politicization of this virus has been just so wacky. At my hospital, their response, I think that they've done, in a way, they've done the best that they can. They have had to, you know, a lot of this information has been figured out. Like we're learning about it as we go. So in the beginning, there, like every day there was like some kind of protocol that was changing, and it was very frustrating to work in like a chaotic environment like that. Um, but uh, especially one where like there's always like protocols, in a hospital. There's like protocol X, Y, and Z for every little thing you do. And then to have it change constantly was frustrating. But I think they did the best they can. I think as far as behavioral health goes, um, I think that in my specialty that there has been poor communication with what like the new protocols are, um, and uh, and so it's hard you know to provide the best care if you can't be consistent, if everybody's not being consistent. um, and then in behavioral health, everybody, all the nurses and all the healthcare workers have to be consistent so that the patients are consistent, so that they're all wearing their masks and they're all washing their hands before all their meals and often, and so that if they need to isolate to their rooms, if they've been exposed or if they are COVID positive, that they're compliant with that. Does that make sense?
Yes. So do you have anything else that you think needs to be added?
Mm, um, I'm one thing I think about a lot is um, how this pandemic and the stress that it's causing, um, causing kids and families who have had loved ones die, um, families who have not been able to be with their loved one who is dying in the ICU. Um, there there is a syndrome called what's it called? The name's escaping me now, but there is a syndrome specifically for family members who have loved ones in the ICU, and I think that there's going to be a lot of almost PTSD, post traumatic stress disorder, um, that's going to show up in people who have been like just devastated um, by COVID. We're going to start to see that coming up here pretty soon. And I kind of think about how, um, once I'm a nurse practitioner, how to best handle that, or how that might look, how prevalent it might be. I don't know. I don't know how prevalent it's going to be or how common, but I think even once the pandemic's over, that we're going to have a lot of effects from it long after.
Okay, well, thank you for letting me interview you.
Yeah,
Um,
absolutely.
it's very interesting.
Cool.